Good morning everyone. Today we are discuss about some questions of human anatomy and physiology. First question: major body system. Which is major body system? Integumentary system, skeletal system, muscular system, nervous system, endocrine system, cardiovascular system, lymphatic or immune system, respiratory system, digestive system, urinary system, and last one is reproductive system. Most important system for SCC coding and why the answer is cardiovascular system, because most chronic high risk conditions like hypertension, heart failure, CKD falls under HCC category and affect risk adjustment. Difference between anatomy and physiology. Anatomy is study of structure, physiology is study of function. Chamber of hearts, four chamber, right atrium, right ventricle, left ventricle. Function of each heart chamber. Right atrium receives deoxygenated blood, right ventricle send blood to lungs, left atrium receive oxygenated blood, left ventricle pumps blood to the body. Artery versus vein. Difference between artery and vein. Artery carries blood away from the heart, thick walls. Veins carry blood towards heart, thin walls are present. Coronary artery disease. Narrowing blockage of coronary artery due to plaque reduce blood supply to the heart. Myocardial infarction. What is myocardial infarction? Heart attack, death of heart muscle due to lack of blood supply. What is CABG and why is it done? Surgery to bypass blocked coronary artery. Why it is done? Done to improve blood flow to heart. What is hypertension? High blood pressure. Hypertension is a condition in which blood pressure is very high, that is greater than 40/90 mmHg typically. Parts of brain: cerebrum, cerebellum, and brainstem. Function of brain parts: cerebrum, thinking, memory, voluntary actions; cerebellum, balance and coordination; brainstem, breathing and heart rate control. Stroke. What is stroke? Sudden interruption of blood supply to brain. Ischemic and hemorrhagic stroke. Ischemic due to blockage and hemorrhagic due to bleeding. Organ of digestive system: mouth, esophagus, stomach, small intestine, large intestine, liver, pancreas, gallbladder. Function of liver: metabolism, detoxification, bile production, storage of nutrients. Function of pancreas: produce insulin and glucagon. Endocrine system: produce digestive enzyme, that is exocrine function. What is hepatitis? Inflammation of liver due to viral, alcohol or drug use. What is cirrhosis? What is cirrhosis? Chronic liver damage with fibrosis and scarring. Organs in respiration, that is nose, pharynx, larynx, trachea, bronchi and lungs. What is asthma? Chronic inflammatory airway disease causing narrowing and breathing difficulty. What is COPD? Chronic obstructive pulmonary disease. Progressive lung disease causing airflow limitation. Bronchitis and emphysema. Bronchitis, inflammation of bronchi with mucus. Emphysema, destruction of alveoli. Function of kidney: filter blood, remove waste, that is urine, maintain electrolyte balance. What is CKD? Chronic kidney disease, gradually loss of kidney function over time. Stages of CKD: first stage normal, mild; second stage mild increase; third stage moderate; fourth stage severe; and fifth stage is kidney failure. What is dialysis? Artificial removal of waste from blood, vein, kidney fails. Number of carpal bone 8. Number of tarsal bone 7. What is osteoporosis? Bone disease with a decreased bone density. What happens in this condition? Bone is fragile and fracture risk is very high. What is fracture? Break or crack in the bone. What is diabetes mellitus? It is a metabolic disorder with a high blood glucose due to insulin deficiency or insulin resistance. Function of pancreas in diabetes. Pancreas produce insulin. It is regulate blood glucose in body. Dysfunction. When pancreas dysfunction, diabetes is happen. Diabetes is occur. Type 1 versus type 2 diabetes mellitus. Type 1 no insulin, it is autoimmune disease. Type 2 insulin resistance plus minus low insulin, it means increase or decrease insulin. Hormones produced by pancreas: insulin, glucagon, somatostatin. Uterus function: site for implantation and development of fetus. Prostate. What is prostate? Male gland producing seminal fluid. Why is liver important in coding disease? Many chronic diseases like cirrhosis, hepatitis affect HCC risk scoring. How does kidney function relate to CKD coding? CKD staging based on kidney function. It determines code severity. Why is pancreas important in diabetes coding? Diabetes originates from pancreas dysfunction. It affects type and complication of coding. How does heart anatomy helps in understanding MI, that is myocardial infarction? Blockage in coronary arteries affects specific heart area, helps diagnosis. Heart anatomy allows clinician to look at an ECG, that is echocardiogram, and accurately pinpoint which coronary artery is blocked based on which heart wall is affected. Artery versus vein versus capillary. Artery blood supply away from heart. Artery carry blood away from heart. Vein carry blood towards the heart. Capillary exchange of gases and nutrients. Function of nephron: filter blood from urine, regulate fluids and electrolytes. Role of alveoli: gas exchange, that is CO2 in and CO2 out and O2 in. Acute versus chronic condition. Acute condition: sudden short term, that is infection, example infection. Chronic long term. Chronic condition is a long term condition, that is diabetes and hypertension. What is hemostasis and why is important? Maintenance of stable internal environment essential for survival. Function of cerebellum. Function of cerebellum: balance, posture and coordination. Endocrine versus exocrine gland. Endocrine gland hormones. Endocrine glands have no duct. It release hormones into blood directly, and exocrine secretion. Exocrine gland secrete hormones via duct.